Greetings, everyone. This is Andy Revkin. I'm at the Earth Institute at Columbia University. We have a new initiative on communication and sustainability that I've been setting up the last 6 months. Started there after 35 years of journalism, telling stories, meaning me telling you something about the world, mostly about what to worry about. Now I am focused on the communication system as a system. What can we do to build better outcomes in the world using the great tools we have, including the one through which I'm reaching you. But of course, that's a morass of complications. And today we're going to talk about complications related to the ongoing spread of this coronavirus, COVID-19 for short. And I have two masters of thinking and acting and policy shaping around complexity, uncertainty, and what do you do when you're faced with an emergent situation where there's gaps in data. It's not like we don't do this. And Jan Kwakkel is joining us first. He's from Delft University of Technology, which is, should I say, I won't say like MIT, but I just said it. So how do you describe Delft University?
Well, it's Delft University of Technology. So we are a polytechnic in a way. So yeah, you can liken us to, I don't know, MIT, Virginia Tech. And in certain fields, we do have a very good reputation. Not surprisingly, flood risk management, which is a topic I work on frequently, and climate change adaptation.
Right, and here we go with yet another global interconnected, messy risk. I want to show people something just briefly before we dive in. And I also like to say, whoops, I just share screen. Hold on one second. I have to do this and this. Yeah, here's one way that an illustrator and a science communicator down in New Zealand described how amid complexity, amid an unfolding epidemic, in this case, there are things you can do, behaviors you can do that can even individually make a difference if enough people do them. And this is one way to illustrate that effect. As a communication innovation hub, we were trying to pay a lot of attention to this kind of thing. So congratulations to Sue and XTOTL down in New Zealand and the spinoff co.nz for coming up with a new way to illustrate something that's important. But pulling back from that one aspect of it, let's talk about the bigger aspects. I think when we think about what's happened so far, we think of the things we know. We know that sometime in November-ish, a virus, a very clever coronavirus, clever is a stupid word, evolution doesn't work that way, but it found a way to jump from other animals to humans. And within a nanosecond of human history, spread through our global connectedness around the world in ways that are profound. We also know pretty profoundly, because of some quick research, that, including by Jeff Shaman at Columbia, that this virus has a stealth component. It can be, a person can be highly infectious and yet not symptomatic. So that's a very disturbing reality. And here comes Rob Lempert in a minute. I'll introduce him in a second.
Okay, great.
So we know that. We know that we need to shelter, as I showed in that diagram. But what are the things we don't know? So your part of this is the deep uncertainty, the complexity that's out there. What aspects of this need to be understood as a deep unknown, and then what do you do next? So Jan, maybe drawing on your work you did a paper in 2012 that had a pretty profoundly apt title. It was, I just had it here a second ago, Adaptive Policymaking Under Deep Uncertainty, Optimal Preparedness for the Next Pandemic. That was 2012 in the context of flu. So what are the deep uncertainties as we're thinking about the things we know?
I think there are many deep uncertainties in this particular case. There's so there's a lot of basic things we know about a virus, but small differences can make a big difference for how rapid it spreads. For example, the reproductive number. We don't know what the reproductive number is.
Can you tell people what that means?
So if I understand it, so I'm not I'm a modeler and I'm more a risk person. But if I understand it correctly, the reproductive number is basically how many people on average someone who is infected then in turn infects. So in the diagram you showed, the reproductive number there was 2, because every dot that was ill then infected 2 new people. For this particular virus, we don't know what the reproductive number is. We can guesstimate, but whether it's 4 or 2 makes a massive difference in how fast it spreads. So that is one example of a deep uncertainty. Another one, I think, which is striking, is that we don't know yet what the role, for example, of children in schools is in how this virus spreads. Most countries in Europe have closed down schools, but here in the Netherlands, they did close schools, but they clearly said we don't do it for scientific reasons, but basically because the call for it from society is so large. And if we then look at Sweden, which has a much more modest outbreak, by and large, schools are open, although at a municipal level, they can decide to close them. Right. So that's another one, deep uncertainty, where clearly we do not know how this virus behaves. Another one, which I think made a massive...
On that front, one of the complexities that was described to me a week ago was that, something like 38% of American nurses have kids. Yep. So if schools close, the parents have to stay home, take care of the kids. Of course, you're creating a pathway of infection in 2 directions from hospitals. So, and by the way, right now I do want to introduce Rob Lempert from RAND Corporation, which is a many decades old research analysis center that grew out of the Cold War, I think. Is that fair to say, or is it predate the Cold War?
Right after the aftermath of World War II, yeah.
And you also have a marvelous additional title. Could you describe your title to the Pardee Center?
Yes, I am director of the RAND Pardee, that's Pardee Center for Longer Range Global Policy and the Future Human Condition, which is a great title. Defies all acronym, and is a center at RAND that does work in this planning under deep uncertainty that Jan and I are involved with.
And I should mention that you both are, I'm not sure if you were founding members of or founders of the Society for Decision-Making Under Deep Uncertainty as well.
Both founding members.
Yeah. So Rob, in the U.S. context, when you think about, I was laying out with Jan the things that we seem to know powerfully.
Yeah.
The virus, it's infectious. It loves being in people. It kills a small but significant percentage of the people it infects. It lingers for a long time before symptoms can come, which is a very scary thing for the epidemiologists. And so among all those things we know, it feels like, okay, so that's all very clear. Then it should be a crystalline, magical solution.
Yeah,
but
and just to emphasize on the known side, I mean, it's not hard to find scenarios out there in the literature, maybe we get to this later, where people talk about, events very much like what we're currently living through. But I mean, I would add to the unknowns is the effects of people's behavior on this reproduction rate. The health agencies tell you to keep a 6-foot distance, right? But we're really, are there aerosol transmissions? Are there other ways? I mean, does a 6-foot, does that reduce the risk to 0? What about 3 feet? How long does it live on different surfaces? As you said, does it, what are the role of children to transmit it? How long are people, how much more infectious are people once they show symptoms versus not symptoms? So all the things that you would like to know in order to give people more precise instructions on what they need to do to reduce the transmission rate. Then there's all the social interactions. How long can people stay in this lockdown mode? And what will be the economic effects of doing so? How should we respond? And then, right now people are really focused on the current crisis. How do we flatten the curve, as they say? But then there's all the questions of, as we come out of this crisis, what's going to shape society going forward? Is this going to increase social capital? Is it going to decrease social capital? And what we do now, how would that affect that?
And by the way, that brings in the political context, which is probably the most complex one of all. And
yes,
we tend to get caught up, including the press, in the kind of political strategizing around these big and actual significant questions about how do you balance social welfare and the bigger impacts of shutting down an economy, which can include health impacts on people.
Oh yeah.
Against the need to stem the epidemic. That feels like. Do you feel like our discourse? How do you feel when you see the way the discourse plays out, including in the press, that seems to caricature? Everything seems to distill toward caricature. You're either for social distancing and stopping the public health threat now, or you're for getting the economy going. This must be driving both of you a little crazy.
Yeah. Well, I mean, to start on the good news side, I mean, I've seen more discussions of scenarios and more of what we would call exploratory modeling out there in the public press in a very aggressive way than any time before. I mean, you can go to the New York Times, you can go to many websites, and they'll give you little places you can go, and you can pull slider bars, and you can see how the epidemic transpires in different scenarios that you can create online. So, I mean, that sort of thinking is out there much more than at least I've seen previously. Jan, I don't know what you think about that, but certainly noticed that. I mean, that said, there is still this gravitation towards single numbers and an inability to distinguish between a worst case number and a forecast. So the governor of California came out as part of his lockdown strategy. He came out with this worst case number, which I think was intended as, if we do nothing at all, including not doing all the things we're currently doing, we would get this many people infected. And the whole discourse around them was people didn't take that one as sort of a worst case and a thing that we could easily avoid taking a lot of actions.
Yeah, Jan, I want to swing back to what you were telling me a few minutes ago about Bergamo, to get to that interesting unknown about what is it that makes these breakout infection moments. But Rob brought up something that reminded me also, because you both work in the climate space, and a lot of people who pay attention to my meanderings and communication online also think a lot about climate. And it reminded me of what the recent debate about the RCP 8.5, that so much of the public discourse around climate risk was built around worst case trajectories as if they were predictions. And that can really distort the overall decision space, it seems.
I completely agree. I do think there's a bit of a difference between the climate discourse and the epidemics. Here, the rate of learning and the speed with which this is unfolding is very, very rapid. Basically, actions we take today, within 2 weeks, we will know what their effect is. In climate, that's a little bit different. The other thing is, since perhaps even more strongly here, we are largely dependent on the societal response to take social distancing seriously.
That's interesting.
Probably using sort of worst case scenarios, as long as you frame them as scenarios and not as business as usual, most likely forecasts, I think might be a defendable way of really, really getting this sense of urgency across. So I think that there are some useful. It's a useful analogy, but at the same time, I think there are profound differences between the two. And decision making here is, I think, quite different from what we have in the climate space.
And I think, well, also here the timescales are just so different. I mean, you're talking here about events playing out literally in real time, and with the decisions now creating that kind of path-dependent outcome, creating that kind of ripple effect that is profound right now with climate.
Right.
Each additional ton of greenhouse gases is adding to risk, but maybe it's a little different in the way that that plays out.
As Jan said, the
Rob, I don't know
timescales
if you-
are so much different. Yeah, the timescales are so much different. I mean,
And
here
sorry.
we act and we get to see what the response in a week or two. We also have all these experiments running simultaneously, different countries doing different things, so we can learn from one another. So the opportunities for learning,
That's very interesting.
yeah, are or at least rapid learning, are much greater. Though, I mean, they do both share the characteristic, though on different time scales, that the cost of delay and inaction can be very can be very severe. That learning aside, if a week costs you in ways, with this pandemic, a week costs you in ways that it's very hard to recover from.
Are there a couple of general principles that this gets to something that Jeremy Zilar, another guest on my show the other day, said, what could you do right now that could make a 5% difference, was his question over and over. And I think, like, if you could name two things, each of you, that you think really could narrow or crystallize the decision space quickly, what would they be?
Given the fact that you're dealing with exponential growth driven by people, stay home.
So that's
driving,
the default. Yeah.
Driving down interactions amongst people massively just slows it down. And you better do that yesterday than today. And every day of delay that you have there with exponential growth and a doubling time of a day or three, wait and see what is coming for the UK and the US. And even here in the Netherlands, we closed down last week, Thursday. I was arguing with colleagues that we should have done it on Monday, because Monday we only closed down the region where it started. And we'll pay the price for that. And then this weekend, people didn't take it seriously. So in 2 weeks' time, we'll see another spike in all the people that went to the beach because the weather is turning nice. People don't realize that even though it is only a 2-week time delay, people don't think in those terms. So the single biggest thing is stay home. And the second biggest thing is proper hygiene. And that's actually the paper that you tweeted about also shows that in the absence of cures or vaccines, social distancing is the only thing you can do. And you better do that aggressively early on. And every day that you delay, you add easily 30-40% casualties.
That's amazing.
Yeah, I agree with all that. I think one of the things that needs more attention, or two things that need more attention now, are what happens after we get to this first stage. There was that very circulated now hammer and dance paper, which says we're doing the hammer now, all the things that Jan just described. Everything that we understand about this virus suggests that as we start to take off social distancing, weeks or a month or two, there will begin to be outbursts again. That's what we've seen in previous pandemics, and that we'll have to repeat this process of social distancing, not on a global scale, but in different regions, and thinking through how we do that, how we eat for that, and how we address the economic impact. I mean, are things we could start to and are filled with uncertainties from how the virus behaves, how people are going to behave, and then a lot just the economic approach, which gives a little bit more adaptive strategy and deep uncertainty now, but wondering the extent to which we are playing out past economic crises, trying to stimulate an economy that public health is really trying to destimulate. And maybe the issue now is liquidity, and that's the issue for them, and then stimulus. And so the economic strategy is a whole nother sphere, which I think is one that needs filled with
So
uncertainty.
setting
and
aside,
just thinking about how we're going to deal with.
but how does that work? I saw OECD was doing some tweeting about this, and but these organizations are pretty limited. Or the group of 7, should they be in emergency session right now if they're not already to figure this out? And who would be in the room to get them off of their usual talking points?
Just a couple of thoughts here. I think the useful so again, the differences across countries here, of course, are substantial. And I think here in Europe, the economic impact, because we have a more developed social system, will be less profound than in the US. I think there were like 2.5 million layoffs just last week in the US.
Yeah.
So you're looking by the end of this, you're looking at an unemployment comparable to what you saw in the Great Depression of the 1930s. So I think the only useful analogy is to look at how we recovered from that, rather than look at the 2008-2009 economic crisis, because that one was primarily driven by banking. And here you have a situation where people just are unemployed at home. And that is really a different kind of economic problem.
Right. Yet my 22-year-old son, who just graduated early from college, is in a profound state of distress. And I'm sure he's part of a cohort of young workers from all over the world. And by the way, I do remember, I was thinking about this, the Arab Spring, the turmoil came about when you had a lot of kids with good education and no prospects. So I hope people are thinking through all these different lines of question.
We have done some work actually on state stability with a think tank here in the Netherlands. And about the most dangerous cocktail that you have is male between 16 and 25, unemployed, no family, no source of income, no livelihood. That's a recipe for disaster and for civil unrest. And depending on how this gets managed in different countries, this might unfold in very, very nasty ways.
Wow. And there too, so that would shape the possible remedies, whether it's jobs programs and the like, as opposed to other kinds of stimulus.
Well, it's all about getting the people at home back to work.
Right. And them are only at home because they were weak, have had to shut down because of the social distancing. And if those places are, still solvent and ready to go in a month or two, the economy should be able to come. I think what more attention, and I think is for the U.S. context, is how to keep all these businesses, and particularly the small businesses, from accumulating debt or going bankrupt during this interim.
By the way,
a matter of stimulus than equity and really reducing their expenses, so that they don't have to pay rent, don't have to pay utilities, don't have to pay taxes, getting rid of their fixed expenses for 2 months.
Right. I did a session on here last week with a microbiologist working on this and a journalist in India. And back then we were talking about this question of how do you do social distancing in India? And today Modi did announce a program. I can't find it here on Twitter right now, but I think it's.
I saw that just before the show.
There we go.
I was looking around.
Orders a complete coronavirus lockdown, and that doesn't feel. I mean, it's hard to think of that in any country, but it's really hard to think of that in a country like India. Not just because there are 1.3 billion people, but you have so much urban, rural movement. You have people with extended families. This gets to that point where you start to think that we're, in many ways, we're still at the beginning of this too. And I don't know how you game that out.
Well,
I mean, go ahead, John.
There's a couple of dimensions again to this. Part of it is the hammer and the dance discussion. And we still don't have any idea on how to dance. And luckily we can learn from what Singapore, what China, what Taiwan, and what Korea is doing. But I think that the impact, for example, on international travel of this event will be much, much more profound than 9/11. I think because you have to maintain a certain amount of separation between global communities to avoid getting these outbreaks. And that means that you have to, at the moment, testing still takes a day. The moment we are able to develop tests that are quicker, then probably you have to do much, much more testing when people come into countries or come into economic regions, if you talk about the EU. And that is then the way how you can do the dance. But you need quite a massive overhaul of your testing system. And also probably a separate form of healthcare, where people with corona-like symptoms go to a separate clinic to get tested and then to get isolated. But that is something that has to be figured out, at least here in Europe, in the coming month.
Yes.
Because that needs to be in place if we want to relax social distancing in June. Then perhaps if there is a seasonal effect to corona, we might have a few months to think through how to deal with the next wave that will come undoubtedly in the fall.
So yeah, maybe Rob, you want to chime in too, but this gets to the politics right now. President Trump is strongly implying that within a week or two, there could be enough pressure that there could be a loosening, at least federally signaling a loosening of social distancing. But it doesn't sound like we're remotely near having the dance capacity. Maybe Rob, if you have an understanding of the dance, what would that look like in America? It would be fast, basically an ability to quickly identify a flare up, do all the tracing, isolate. Is that what the dance is?
Yeah. And yes, as I understand it, that there'll be pockets that'll take off. And so, yes, it'd be ability, as Jan was saying. I mean, you need the testing capability to quickly figure out where coronavirus making a reappearance, healthcare facilities so that they could be treated. Obviously, the stockpiles of equipment that we're now missing that could be brought to an area doing it. And then I also think, we on the social economic side, there need to be ways that the communities where this needed to be done would have a sense that they were going to be made whole from the end. Otherwise, you'll have these, a lot more resistance to doing it. I mean, if people have a sense that they're going to be made whole at the end of it, then you're probably going to be a lot easier to reimpose the social distancing. I think another aspect of this is being able to, and perhaps one of the hardest, is to be clearly communicate, what this is going to be, because people are going to have trouble, doing this again and again without a clear sense of what's, how it's going to work, why it's a good idea, how it will basically make us, help us be better off at the end.
Yeah, right. We have another guest who's going to pop in shortly, Rod Schoonover, who was on the National Intelligence Council for a while. There's other people who have been invited, but they're probably going to come tomorrow. Deborah Brosnan, Alice Hill was on last week, talking about these issues. And there was a question that I've just posted here too. Jason R. Wang says, to your knowledge, to what extent are the various models being used by governments around the world? In other words, who's tuned into these? Who is on your consultation list? Who out there has got this in the foreground?
I think there's a couple of answers to that. Of course, we saw the Imperial Study last week that seems to be quite influential in changing the policy, in the US, in the UK, and apparently it was also discussed in France. I have many questions about that model, but at least clearly it made a difference. And it at least
did it make a difference because it was sort of the RCP 8.5? You know what I mean? Because
so my take. So at the moment they're working with Microsoft to open source the model.
Interesting.
So actually, it will be on GitHub, I think, next week. Which I love. I look forward to seeing that model. I think the reason it worked is indeed because it presented a conceivable, defendable worst case where at least what they were trying to do in the UK with building up herd immunity would completely overwhelm the NHS and results in millions and millions of deaths. I think that really struck a nerve and made a difference. Beyond that, that model I think has limited use. Here in the Netherlands, there is the RIVM, so that's the National Lab for the Environment and for Health. They do quite some detailed modeling, largely statistical, but quite extensively, with detailed information on movement patterns of people, how different cohorts interact with people from other cohorts. So they can do a reasonable guesstimate on how this pandemic is playing out in the Netherlands. I would love to get my hands on that model. We know them personally, but of course, now it's too late. I think so. Other countries, I just can't judge. But I'm pretty confident, and in many countries, people are working with models. The issue then becomes how are we using these models? And the point with pandemics, and because it's exponential, looking at expected values over a distribution just doesn't cut it. You have to look at your tail risk here, and that is much more profound, and I think often underestimated.
For the average, for people listening, can you, those of us thinking about climate and the like are always talking about fat tails and tail risk. So what is tail risk?
Sort of the worst case is much more plausible than we think it is. I think that's the easiest way to understand it intuitively.
And plausible is different than probable.
Right. Yeah. Right. I mean, I think what you've seen is that the basic result of the models has been pretty influential in forming policy so far, which is that we need to flatten the curve and need to take the extreme social distancing as early as possible in order to do that without overwhelming the healthcare systems. And I think that message, which is robust across wide ranges of assumptions in the models, has been picked up. I think the places such as the UK that were initially thinking of this mitigation strategy where you put the vulnerable people, isolate them and develop herd immunity in the rest of the population, were really risky, going back to the this tail risk, that there were plausible assumptions where it might work, but that they were really very vulnerable to massive failure, and that pushed people back into this social isolation. I think certainly in the US, people are madly trying to put together models and put in policy relevant form these models. And I think they'll really start to come into play as we get into this, dance part of the of this pandemic, where people are starting to chafe at the social isolation, and how do we start to relax that in ways that keep the virus, allow the economy to come back, but keep the virus suppressed. And that's, I think, where we'll have a real challenge of trying to use the modeling plus real-time data collection to manage what's going to be a much trickier policy in many ways than just the hammer part, which just requires getting people to think seriously about this risk.
It would be good to see some more public messaging around the importance of thinking about the dance part right now, not just thinking about it, but actively creating that capacity. And that one thing that excites me is that that's an area where you can have a lot of social engagement. Where recently I was on a webinar through Council on Foreign Relations with the folks at the endingpandemics.org. And they always stress putting the public back in public health. In other words, citizen science, citizen capacity to monitor, to know when, to help build the data that can show you when there's a flare up. Rod Schoonover has joined us. I had no intention of this being a boys' club, but just unavoidably today it's an all-male panel. And there, as I've said, we've had a bunch of people from different parts of the world and different genders on this show, and there will be more. But right now, it is a boys' club. And so, but Rod, you were at the National Intelligence Council. You were on one of the sessions we had right at the early stages. What are you thinking when you think about this transition to the dance part, and/or just like where we're at with the complexity
Yeah.
And how that relates to the politics. A minute ago, we were talking about how the media tend to focus on this as a Trump versus everybody else thing, and that distracts from some of these background complexities.
Yeah, so before I answer that, I just wanted to give you a shout out, Andy. I think this is a really effective, form of communication that you are experimenting with, and in this time of everyone being at home and glued to the computers, I think this is really an innovation. So, and thanks for having me on. And I have been listening in on the prior part of the discussion. I think it's really interesting how we're seeing this tension between what the science tells us to do and what human nature is telling us to do as well. And these two things are, sometimes at odds. And and I think we have to understand that a purely technocratic, and I say this as a physicist, but a purely technocratic fix that doesn't really take into account the social aspects of the human condition are going to be problematic. And I think at one point I'm somewhat horrified by increasing calls to relax and open up our economy and open up our business. It feels way too early for those kinds of discussions, but those discussions are going to come anyway. So how do we balance this very draconian response to how human beings want to interact and live their lives? And discussions like this can help, but it's first of all, I think this tension is happening way faster than I would have expected. I would have expected a lot more of the going stir crazy to happen in maybe a month, 6 weeks later. But it seems at least some folks in the administration, 1 week, 2 weeks was just too much. Yeah. So we'll see how serious these calls were. It might have just been a trial balloon to see how people would react. Well,
there was a major editorial in the Wall Street Journal late last week,
exactly.
Which I think which got Trump's attention, and
that's right.
But there also I've seen serious, like Howie Frumpkin, who used to head the National Center for Environmental Health, on Twitter. We were having a back and forth in this, and he was just saying the point that Rod said, that this is a real balancing act. It's not the technocratic. You have to model that in, I guess. You have to model in. I don't know how you add that to a model. The social dynamic.
Well, you can model it. You can, by allowing. Basically, you're allowing some give in the social distancing, right? Because that's really what that means. Unless we completely innovate how we can get back to our economic and social models.
Yeah. So the Imperial Study had some of this. So they had a control policy on the social distancing rate. And you can see how you can, by turning on and off basically social distancing, you can dance it out. Of course, if you want to do that, translate that from model land to the real world. What you're talking about is regionalizing the world, explicitly monitoring exchanges between regions, and having much more monitoring in place. And then if you see a region sort of going out of control, close it down by draconian social distancing, as we now see globally. And in that way, you can dance it out. And it seems that is the direction that some country like China is going. So all the reported cases now coming out of China are people flying into China. If you fly into China, you go into quarantine for 2 weeks at your own expense. They're now slowly relaxing the movement between the regions again, but only if you have a health certificate, which implies that there is a lot of control there where you have to get checked if you want to travel. Those are the types of measures that you can think of if you want to do this balancing act, allow people to travel to some extent as they were used to, without getting another massive flare-up.
Right. And the sort of thing that you could start crafting communication strategies about, once the curve flattens, once we see this, we can begin to relax that, so people have a sense of what's coming. Right now, it's tends to be very draconian, and will increasingly become unrealistic. In Los Angeles, where I am, they just recently push back when they think this, when they say that the schools will open, but it's always they just give a date. So let's say, well, it used to be this date, now it's this date, which is they're sort of missing the idea that where we can reopen things once we see certain patterns in infections and capacity in the hospitals.
One thing that we've been talking about on some of the earlier programs was when you mentioned communication strategy. Again, in the United States, there isn't really a strategy. In fact, there's the media, and there's the president tweeting, and there's Tony Fauci kind of putting out little fires.
Yeah. And lots of governors and mayors doing good.
And lots of, right. Cuomo is exemplary of a more productive way of doing things. But so far, the media here just today, Zeynep Tufekci wrote a piece in The Atlantic on the failure to understand the systemic nature of this problem. And just if you haven't seen it, here's the piece.
Yeah.
It wasn't just Trump who got it wrong. And she says that we all had time to prepare for this. But we squandered it because of widespread asystemic thinking, the inability to think about complex systems and their dynamics. Widespread asystemic thinking may have cost America the entire month of February. And my wife, who works for a tiny nonprofit education organization, 5 people, they teach teachers how to teach systems thinking, right? But it's like this tiny little places. I remember way over a decade ago in Nature, in the journal Nature, there was a news report on, do we need to go to risk school? Yeah. People could just Google for risk school in Nature and they could find it. And how much of can we learn this? Is there something you all learned? Was there a moment you learned in school something that made you say, wow, this is complicated. That's cool. As opposed to, this is complicated, I'm going to get a headache. So how big a deal is this lack of integration of that kind of thinking?
A big deal, I think. I think that article is great, and people do have trouble thinking about novel situations and about the interconnectivity of it. So I think the article talks about, that people compared the coronavirus to the flu and never added them together with the constraint of hospital beds. And that's the thing that's going to cause, so many of the deaths in developed countries, is that we're just going to overwhelm the healthcare system because it's flu and coronavirus and all the other elements that happen at the same time. I would add to that, though. There's one thing that I thought was missing is then this the motivated reasoning, the cultural cognition, the fact that and this goes back to the worst case scenarios, is that in this world of uncertainty, people will tend to glom on to a positive scenario as an excuse not to act, and you see that for much of February. Well, it could be bad, but it might not be. You see that now where people say, "Oh, look, well, this drug looks promising. It's going to come along and save us." And so it's also the complex system plus the failure to keep the different scenarios in mind at the same time.
Just to add to that, I think there's 2 things that are particularly interesting about this particular outbreak. One is, of course, people are unable to think about exponential growth, and people are always stupefied about how fast exponential growth is. Also, even here in Europe, I think most countries were sort of prepared for it, that it was coming. The plans based on primarily the Mexican flu were available, and even here that some of the experts were saying we were stupefied by how fast it went. So in particular the early phase, it went much faster than they thought, and they had to go much quicker to scaling up and scaling to a different type of response. And I think the other thing that people struggle with is the delay. So there's something like, well, up to at least 5 to 7 days on average, I think, between getting infected and showing symptoms.
Yeah.
On top of that, you have a 2-day delay of the test. Typically, in many countries, people only get tested after they have become seriously ill. So you're looking at a delay of about 2 weeks. So the moment you start seeing that you have a real problem, the outbreak has doubled. Using a double time of 3 times, it doubled 5 times.
Right.
And with exponential growth, that is just mind-boggling.
Yeah.
Right.
So
I have to share something very briefly. If you can look at your screens, you'll see it. A long time ago, in the context of human economic and population growth, someone created the impossible hamster, which is I love this. I wrote about this on .earth a long time ago, and it is something that's hard for us to get our heads around. Along with, here we go.
Okay.
Along with timescales of change, and it just seems like do we need a techno fix to help us, an app that can help us? I guess that's what models are in a sense. But then,
exactly. Yeah.
How do you turn a model into action and response?
If I might jump in on this, because I was still in the intelligence community when the Ebola crisis was hitting West Africa.
Right.
And, I was the lead scientist for the Bureau of Intelligence and Research at State Department. I found myself, when I was talking to principals on this issue, a lot of it boiled down to what does an exponential increase actually look like, especially when there's, as Jan was saying, there's built-in delays in response, whether moving ships or airplanes or getting supplies together. But that wasn't that long ago, right? That was 2012, 2013, 2014. That was recent enough that should have been, at least in the United States, a real wake-up call in terms of how logistics were not in place. And you asked the question about systems thinking. I would say that entire swaths of the U.S. government, and I would argue practically every government, has different considerations, different issues and silos, and are almost structurally incapable of deep systems thinking. And so everything is disconnected. And those of us who work on issues like climate change or ecological change are a little bit further down the path, but I think we are ourselves victim to the same human frailties, cognitive shortfalls in thinking about what this really means with second order effects and third order effects and cascades. And but I think this is something where science and modeling can be such a network theory, be such a help to us. And just one last point on the media being at fault or having the same shortcomings that the administration. Well, if you look at the wide spectrum of the media with respect to talking about our vulnerability, there are voices in the media. If you go back 2, 4, 6, 10 years, Laurie Garrett, who's been on your show, have been warning about this. And so there's more of a spectrum of voices in the media. But when you look to government and its response, we shouldn't have that same spectrum. We should. I think there's a serious problem when we don't have the singular message from the administration on the seriousness of the evolving issue.
Yeah. There are a couple of fantastic questions that came in. I'm going to pop them on the screen and we could address them. Patrick S says, but also every self-professed expert can pop his own COVID model on how do you pronounce ARC-XIV or medium and drive public opinion. How can we separate signal from noise when crowd modeling uncertainty, uncertain existential risks? You know, how do you, you know, that just as we were saying, like with the status quo bias that Rob described.
Yeah.
You know, we glom onto the model that suits our predisposition too. Thinking, thoughts?
I mean, I should hope that you know, the governments and decision makers are working from. Well, let me back. So, I mean, you find when working with models in policy making that the model produces going on is trust between the policymakers and the people generating the numbers, and so
that's right.
You would hope that governments at all levels have trusted scientists that and models that they're working with, you know, either in the federal agencies, at states in the U.S. that have their university systems and such, so that the model produces forecasts, but they're really trusting the advisor. The crowdsourcing part, I mean, I think is useful for the stress testing idea. You know, so I mean, models have shortcomings, experts have shortcomings, and that ideally this vast sea of other models, if they're producing something that's really different, they're worth a quick look to say, is that just because the model's bad or dumb or just has some strange assumptions that we're not going to plan against, or is there something in that model that is missing in the models that we're using that we ought to bring into the analysis?
And maybe Jan, how does this feel? My sense is the capacity for kind of rapid assessment, whether it's of a model or of data, is so vastly expanded now that the system through which people like you guys and the others in this field and postdoctoral students and others can really dive in compared to 10 years ago is just astounding. I think maybe that's why the question had that, how do you sift part? But I think that we're really close to advancing this. I've seen examples in climate literature where papers pop up, they get a lot of attention, and then they do get nuanced. The nuance does come in eventually. It's always imperfect. These caricatured papers on this or other issues tend to get the most focus initially, but then things settle down. Is there some tweak to how we all interrelate online? Even experts assessing models, or the public or policymakers assessing their expert messaging that can you think of a way to kind of advance that? I
think that there's a couple of dimensions to this question. A lot of the models that you see in this particular outbreak are highly stylized, theoretically toy pieces and interesting to play with. And I've seen some beautiful examples that sort of drive home the basic mechanisms at a theoretical level. But this is like a 7 million or a 20 million body problem. So just understanding the theory doesn't solve the problem, and the devil is in the details. And the data you need for accurate policy relevant models is just staggering. If you look at the Imperial Study, they had detailed telephone data that drove the model. In the Netherlands, the models that are being used again are partly based on telephone data and Google Street Map data. And Google and TomTom navigation traffic data. So we know patterns of behavior. There's all kinds of survey data. That type of data, those types of models, you cannot put online overnight. So I think that's an important distinction that is relevant to the question that was raised there. I do think that there is a move towards open sourcing models. We see that in the climate space. We hope starting to see that also in other domains. And the fact that now the Imperial Study will become available on GitHub with the help of Microsoft, probably in the coming weeks, makes a massive difference for figuring out the dance part, because that exposes the assumptions and allows people to play with those assumptions. And I would hope that those types of developments carry over also into other models that are being used for policy by real world decision makers. So I would love if the models that are being used by the CDC or by the Dutch equivalent of that, or the European equivalent of that, would become available on the principles of FAIR for interested researchers to play with, rather than people protecting them, protecting the data and everything in it. Because you need to have a collective, collective intelligence, people looking at those models from multiple angles, playing with them, to really understand what you can and can't say with those models, right, rather than just betting on a single heroic set of assumptions to drive policy.
The other question that came in is pretty related. Aviva Romani says, question from Eugene Turner: how will the necessary transformations occur to go from the cacophony of false economies and pseudo futures to sanity and equanimity? We need to go beyond restoring to the pre-virus conditions. This gets to the pre-virus condition. You know, yes. I want to give you one little cue that on Friday, I did a pretty great conversation here with a poet, a comedian, and a storyteller on how they're adjusting to not being in front of an actual audience and using online tools. And Irene O'Garden, the poet, said she feels we're poised not to go back. Because this is teaching us several things. One is that being in enforced isolation, and being online is reminding us of the value of actual interactivity.
Right.
And that it's actually enriching our sense of wanting to hug somebody. And that like, so that when we get out, we'll have what she called, this is not going to be a great recession or depression, it'll be the great compassion, which is kind of another way of what that commenter just said. So you know, knowing what you know about system lock-in, about path dependency, about American political structures, about the supermajority in the Senate, about how our media are polarizing us and not connecting us, about social media doing it even worse. Is there a prospect of a shock to the system like this actually getting us enough of a clean slate to start shaping a new system?
Well, I'll say, I think,
go ahead. Yeah.
Unquestionably. I'm sorry.
Yeah,
I would say unquestionably. And one of the things.
Rod and then Rob.
Okay.
Yeah.
Sorry.
One of the things I think is interesting is watching this unfold, this pandemic unfold week by week, and it's like each week is a new week. And in the United States, we're not even close to the worst part yet, right? And the WHO came out today saying that the U.S. is probably going to be the new epicenter globally. And so one of the things I think is interesting, a lot of this is theoretical. The four people on screen right now have thought about really terrible scenarios for most of their careers, and we may be arguably predisposed to think that this may really get pretty gnarly. And so that's why I think we're more likely than others, although I think large parts of the population are going to come along on this ride, as seeing this as a transformative event. And the idea of going back to pre-virus conditions, this is hysteresis. This is the paperclip that's been bent too many times. It doesn't go back. And so, what does it look like on the other side? I don't know. No one knows. We can hope that we return to some state that has more compassion. We did see that with other great tragedies. So that's my hope.
I would just say that, I think it's virtually certain that this crisis is going to lead to something different on the other side. And but one of the things that we can do now that will, I think, significantly affect what we transform to is the sense of solidarity or grievance we create as we go through this crisis. I mean, if we come out the other end, people with a whole new notion of what it's like to live virtually, a sense of social isolation, but felt that they were, adequately well treated, that the society functioned and treated them well during this crisis, I think that leads to one scenario. And if people come through feeling that aggrieved and mistreated, and that they were not treated well by their institutions, that leads to another set of scenarios. So that's, I think, one of the things that we need in the coming months. But yeah, the transformations that we'll see in the years and decades ahead, I think, are going to be extremely influenced by this.
Right.
And is this where one concept I started writing about among all the divisions over climate policy and energy policy years ago was that I found in the literature on ecosystem resilience was response diversity. That Thomas Elmquist wrote a paper in 2003 about in an ecosystem, response diversity is more important than biological diversity. That the diversity responses from organisms that that have a function in an ecosystem is what to a stress is what creates resilience in that system.
That's right.
And that feels very much like the human experiment. We have China, we have Europe, we have the United States, we have India. We have a lot of experiments. Someone mentioned this earlier in the context of viral response here, and that's probably a good thing in the long run.
Yeah.
Well,
with the one caveat that, go ahead, Jan.
Well, I agree up to a point. But what we at least saw here in Europe is that at some point political pressure becomes too high and you see herding behavior. So countries are starting to copy one another's response before they have seen the effects of their own response.
Oh, that's interesting.
So there you see, for example, very, very simple in the Netherlands, we were not closing schools. Politically, it became unviable to maintain that policy, even though on scientific grounds they didn't thought it would make a difference. So they closed the schools. Therefore, we don't know and still won't know what would have happened if we had kept the schools open. Luckily, Sweden is still keeping schools open to some extent, so we can look at what Sweden is doing in a few years' time or a few weeks' time.
Yeah.
So maintaining diversity in response looks very, very good on paper, but if you have a very, very strong political pressure, and of course, in this connected world where everyone is mimicking what everyone else is doing, there is a big risk that we all herd towards the same kind of response.
Yeah. I'll just say a big difference between human systems and biological ones is human systems have foresight and they have memory. And so Jan was talking about the foresight, so people are going to tend to cluster. And then on the other side is the memory. If certain people felt that their experiment went badly relative to others, they're going to perhaps hold a grievance as they go forward. So I think, the biological analogies are very helpful, but I mean, I think that those human systems have at least those big differences, which are going to affect its both its short and long-term behavior in really important ways.
So one of my closing thoughts every day on this is going back to what Jeremy Szilard brought up. He used to work at digital.gov in the United States in the White House, also fostering better performance on websites serving public functions. And he's now in Brooklyn helping communities figure out, he's actually doing volunteer work, helping people transition to online impact. But he says, he always says, what's the thing that you could do after we end this call personally that could change some trajectory 5%? And I think it's a useful question to ask. It's not always an easy one to answer, but in this community of modelers and advisors, what feels like a tweak to the systems that could marginally get us toward some less bad outcomes here, or maybe good ones? Who's not in the room today? Who could be a benefit from this discussion, or anyway, that's the question.
Yeah. Well, I've social distance. Make sure everybody in your network does it. But I mean, I think as we were discussing, I'm starting to think seriously and communicate seriously about the dance part of this. I think is and then figuring out how we make sure that people don't go bankrupt because of the social distancing that we need to do are going to be two critical sort of near-term weeks, months thing.
And do you see a way to rationalize public discussions around that point, that the bankruptcy of the system, the actual economic harm, is something that has to be weighed against the public health?
Well, I mean, I think I'm
efficacy?
talking more about tactics, and I think you start to see, discussions of that the key thing is maintaining liquidity as opposed, stimulus comes later, but let's maintain liquidity, and let's kind of, reduce people's fixed costs so they can survive this. I mean, so I think that's a tactics that we're starting to get into. And then, but then, as we were discussing, I mean, I think this is a place for the modelers and, and then kind of mediated through the communications. How do we talk about and get ready for the need to do this dance in the months ahead where we relax restrictions, and then when it starts to flare up in particular places, what are we going to do and get people, start to undo in terms of preparations, testing, et cetera, and what we need to do to get people's heads around it, which gets back to the, helping people think the complex systems that, this is not a point, this is an oscillating system, and communicate, what people should expect.
One question for you all to crystallize this. I'm on this WhatsApp list of people in Africa in global in disaster risk reduction, and it's starting to percolate, the infection rates and stuff. And in sub-Saharan Africa, there are entities that don't have access to this kind of thinking right now that could help them get a little bit ahead of what's coming there. Or South America, or it's this. There are these big chunks of the world for which this hasn't quite erupted yet. It's still actually possible to get ahead of.
Well, one thing I think is an issue here in the U.S., and I think is an issue broadly. We've landed on the idea of social distance, the term social distancing, which I think is very effective. And those of us, who've looked at R-naughts and how that, changes with time, it's a very effective term, catch-all. But I don't think it lands on the public as well as it could. It could be more granular, and especially from a state or regional leader saying, well, this is what social distancing means. Go to the grocery store once a week. Going into the car is fine, but don't get out of the car. Just more concrete communications of. But it's almost become too many things. It's too nebulous. Yeah, too nebulous of a term.
Jeremy Zalar, actually, again, he said he rejects it, unfortunately, because it's giving the wrong signal. It's actually physical distancing we want, not social distancing.
Yes,
you want social cohesion with physical distancing.
Yes,
I do agree that calling it physical distancing would have been better. But the other point of Rod, I completely agree with. The struggle that you can witness in government officials here in Europe trying to explain what it is they mean without having to resort to actual enforcement by the police or even the military. I think in Spain, that has been a very, very hard problem. And for me as a modeler, I immediately understand what is meant. I've played with those models. I know what they mean. But even if you talk to other people that don't know these models, don't understand what these terms mean, can I go out for a cup of coffee with someone? Can I go out for a bike ride with friends? Can I go for a run with friends? Right. It's bringing it down to that very, very basic level that people understand what it is that they have to do or should not do.
And this is an important point that you were discussing before I got online. The understanding that this virus, the shedding phase in asymptomatic patients is more than was suspected or assumed, and the idea that people can be contagious either well before symptoms or maybe not even showing symptoms, I think is a really important piece of the communication that is so far, at least as I've seen, pretty piecemeal. Some people land on it and some people don't. But the idea that, no one that I know of has said something as sharp as just assume that everyone at the grocery store has it. Right? I mean, because, again, that's pretty draconian, but it's also, it may be truer than not true in some parts of the country.
Yeah.
Right. Well, we're sorry, Jan. Yeah.
Well, just piggybacking off that idea, if you look at the situation in Japan, the outbreak is relatively flat, and that is because people, the moment they are, even if they have a cold, they already sort of self-isolate and they wear face masks. They wear face masks not to protect themselves, but to protect the other.
Right.
And I think messaging on that point could also help. Behave in a way that you might infect others, that you might be responsible for someone else getting in hospital. That, I think, that's a message they're trying now in the Netherlands. I do see that resonating with people in my environment.
In the Netherlands specifically, is it with wearing masks? It's the broader point. Behave as if you are infectious.
Yeah,
right.
That you might infect someone else, or you might infect your grandparents, who then die.
Right.
And even the Prime Minister was talking in those terms explicitly.
Right. Well, this has been a really sobering, but also, I think, vital conversation. We're doing another one tomorrow. Salim Ali, Deborah Brosnan, and oh my gosh, someone else are going to be on to discuss ecological models as they relate to what we're seeing now and where we go from here. And on Friday, we're going to have a discussion of economic models. And next week, guess who's going to be on next week? Herman Daly, the father of ecological economics. I just contacted him, and he's socially isolated, but he's going to be physically with us on Sustain What. So this is, I'll end by just saying, I'll put in some boilerplate here. Why not? Sustain What is a global conversation identifying solutions to the complicated, shape-shifting, and epic challenges humanity's Anthropocene moment confronts us with. Our prime focus is making sense of and getting the most out of the planet's fast-forward information environment. It's the one Earth system changing faster than the actual environment, the ways we communicate. And it's more consequential than anything I think that's come before. For the time being, these sessions will be focused on mitigating the unfolding societal disruption and devastation driven by the global spread of coronavirus disease 19, best known today as COVID-19. But we will dip into other subjects and solutions when the time is right. Of course, getting back to climate change and conserving Earth's ecological bounty and creating more social equity and much more to come. And to me, it's all about the communication innovation has to be in the foreground. Getting modelers, in this case, in more of a direct conversation with artists who could turn models into brilliant visualizations is one step I think that can happen increasingly. As I showed at the very beginning, there's this fantastic experiment, and all these experiments are showing the value of social distancing. So stay with us. We don't have a homepage for it yet. The best way to keep track of this is following me at Revkin on Twitter or through the Facebook links and YouTube links that you can find online. Thank you both. Thank you all for being part of this. Maybe we'll swing back in a few weeks to see which way the needle is tweaking toward communitarian and cohesion or toward tougher outcomes. Thanks again for being part of this.
Thank you.
Thank you. Bye-bye.
All right.